The short answer to the question of whether you can be diagnosed as an adult without ever having been diagnosed as a child is yes, but there are several scenarios that would precipitate that. The first scenario is just in very bright ADHD children without hyperactivity or conduct disorders. So these are children that are always seen as a bit of a nutty professor, a bit of a dreamer, but they're very bright and with short bits of attention span can really do very well. And if they don't have a learning disability, they can fake their way through school without too much difficulty. They will never do extremely well, but they will do fair enough and people will not be particularly concerned. And as these children are not obnoxious or aggressive or demanding or challenging, well, they can probably pass right through. The danger of this group of children, of course, as adults, is they virtually all have depression. So this is a major complication of undiagnosed ADHD in childhood. But there's some new data that's come out that is quite fascinating now that indicates that in our lifetime, we have 3 sets of chromosomes that take over. In other words, we have one set of genes that predict us our future as a baby and as a child and as an adolescent. Then mid-adulthood, we get a second set of genes that go on into adulthood until sort of middle-aged years. And then in middle age, we have another set of genes that takes over. And now it looks quite obvious that people that were never diagnosed as ADHD in their youth may actually be diagnosed as ADHD in their adult years or even in their late years. And this is a fascinating concept. And the research has shown that at least 10% of adults who have ADHD never had ADHD as children. So this is a fascinating concept, which means that our genes are extremely important in the way that we present with ADHD symptoms through our lifespan. And some of the things that we've often thought were environmental might actually still be of genetic origin.